Hello, my name is Maz Macias, and today I'll be presenting my project on medical marijuana and should it be legal. This is a topic that has sparked a lot of debate across the country, and for my presentation, I'll be sharing both the pros and the cons of this issue, looking at the history, the social impact, why it matters to me, and whether people agree with it or not. Medical marijuana has become a big part of public health and legal conversation in the recent years, so let's take a dive to see what it really means and why people care about it so much. So my second slide. What is medical marijuana? Marijuana refers to use of a cannabis plant to treat or manage certain health conditions. This plant contains chemicals such as THC and CBD that can affect the body and mind. These chemicals can help reduce pain, nausea, inflammation, and many other symptoms. Medical marijuana is different from recreational marijuana because it's used under a doctor's supervision, and it's meant to relieve symptoms, not just for personal enjoyment, but for overall health. It can help patients who don't respond well to traditional medications or treatments when they have no more options. There's marijuana that they can go to that can help them get some relief from the symptoms and pain and all that. Critics say that it does lack regulation and could be harmful in the long run, and that's why the issue continues to be a big debate today. So the history of marijuana. Medical marijuana has a long, interesting history. It's been used for over thousands of years, starting in places like China and India. And back then, it was used to treat pain, nausea, and other illnesses. In the 1800s, marijuana became a common medicine in the United States. But in 1937, the government passed the Marijuana Tax Act, which made it hard to get or use marijuana legally. Later, in 1970, it was classified as a Schedule 1 drug under the Controlled Substance Act. This means it was labeled to have no medical use and a high potential for abuse. This stopped researchers for many years, as they couldn't, do much research on it. Things changed in 1996 when California became the first state to legalize medical marijuana. Since then, many other states have followed. Now, it's legal for medical use in 38 states, including Washington, D.C., and this shows how public opinion and laws have shifted over time. Okay, so the next slide is explain how the social issue might affect both the individual and the greater society. So sociological imagination is the ability to see how personal issue or situation are connected to a larger social problem. So when it comes to medical marijuana, this means understanding how one person's health struggle ties into a bigger issue like with law and public opinion. On a personal level, many patients use medical marijuana to relieve pain, reduce anxiety, or to cope with serious illnesses like cancer or epilepsy when another treatment is no longer working. So they use this so they can have a better quality of life without any major / bad side effects. But on a larger scale, when you think about it society-wise, medical marijuana can affect society because the legalization can lead to fewer arrests and less overcrowding in prisons for non-violent drug offenses, and can shift the people's view to marijuana so they don't only see it as a bad drug, but like a possible medication, just like any other medication we have out there. It can also raise questions about who gets access to it and whether doctors should recommend it and how it should be regulated. Okay, so our next slide would be the pros. So our first pro would be the medical benefits of marijuana. One of the biggest reasons people support marijuana or medical marijuana is because it helps relieve chronic pain. Many patients with conditions like arthritis, cancer, or multiple sclerosis have found that marijuana reduces their pain when other medications don't work. Unlike opioids, which can be addictive and deadly, medical marijuana doesn't have the same risk for overdose. Patients often say that marijuana helps them live a more normal life by making their pain manageable. This is especially important for people who suffer from everyday pain and just want some type of relief. So some believe that marijuana is like a safer option for long-term pain management, and this improves the patient's quality of life without any major bad side effects or consequences of them being in pain every single day. Okay, so our next pro is fewer risk of opioid abuse and death. So this is a major benefit of medical marijuana. This might help reduce opioid use and overdose deaths. In states where medical marijuana is legal, studies have shown fewer opioid prescriptions and overdose rates. Some researchers believe that marijuana can be used instead of or alongside opioids to help treat pain without any major risk. Since opioid epidemic is huge right now, it's a huge issue in the US. Having a safer option like marijuana could actually save lives and reduce the number of people who become addicted to painkillers. Okay, so for our third pro, it would be that medical marijuana helps medical conditions like epilepsy, PTSD, and cancer, and like any major symptoms. So medical marijuana has been shown to help specific medical conditions like epilepsy, PTSD, and cancer-related symptoms. For example, a child with epilepsy who suffers from like seizures may benefit from CBD, one of the compounds in marijuana. Cancer patients often use marijuana to help reduce nausea caused by their chemotherapy. Veterans who have PTSD have also reported feeling calmer when using it. So marijuana has been shown promise when other treatments fail, giving hope to patients when they're running out of options during these difficult times. Yeah, so I would say that this is how like marijuana can fill in an important medical gap when needed to improve the patient's quality of life, because sometimes when the medications that are provided by the doctors don't work, they kind of have this feeling like, like there's nothing that can help them. And sometimes they try medical marijuana, which is prescribed to them in legal states, and it does help them. And now they have something that, shows them promise when everything else fails. So, yeah. Okay, so now we have our cons. So, our first con would be the potential for addiction and abuse. So, even though medical marijuana helps many people, some are against it because it can be addictive. Marijuana isn't as addictive as other drugs, but long-term use can lead to dependency, and some people might start using it for reasons other than medical needs. There is a concern that legalizing it for medical use could lead to more recreational abuse, especially amongst teenagers or young adults or those without a prescription. Critics argue that we should be careful with how we prescribe it and how it's used to avoid it being misused. Okay, now we're going to be going into our second con. So there are many side effects and health risks that come with medical marijuana or with using it. Some users report side effects like dizziness, tiredness, memory loss, mood changes, and in some cases it can even worsen mental health problems like anxiety or schizophrenia. Critics also say that side effects can be dangerous, especially if the person is using marijuana daily without the right medical supervision. And while it might help some people with like their symptoms and their pain, it can also harm them and others if it's not used properly or if it's misused. Now we're going into our third con. which is the lack of research. So this one is one of the biggest arguments against medical marijuana, is that there hasn't been enough research to prove that it's 100% safe and effective for all conditions. Because it's still a Schedule 1 drug, scientists face strict limits when trying to study it. Marijuana products can also vary in strength and ingredients, making it hard for doctors to know how much to prescribe or which products to recommend. Without FDA approval, there's no official guidelines for dosing or treatment, which makes it even harder to use it safely in a medical setting. Personally, I believe medical marijuana should be legal in all states. It gives patients another choice when they're suffering, especially when other treatments don't work. I read about people with epilepsy, cancer, PTSD, Parkinson, Alzheimer's, and they all said marijuana has helped them live better lives. And you can actually see a physical improvement. I also think that it's safer than opioids, which has caused so many deaths in this country. While I understand the risks, I believe those can be managed with better research, education, and medical supervision. Medical marijuana is growing as people are learning more about its benefits, and this issue matters to society because it's about compassion, healthcare, and giving people relief when they need it the most, when they have nothing else to help them. Okay, and these are my resources. Thank you guys for watching and listening.